Hello, everyone. Today we're going to be talking about the roles between an athletic trainer and other members of the healthcare team. Before we do that, though, we're going to review the information from yesterday's lesson. So I want you to take some time to review these questions. You can pause this recording while you review these questions and then press play when you're ready to move on. So the first role we're going to discuss is the athletic trainer and the athlete. The major concern of the athletic trainer should be for the injured patient. So they should be the advocate for the injured patient. All decisions the athletic trainer makes impacts the patient, and the injured patient must always be informed of the how, when, and why the athletic trainer is doing the treatment. So for example, how is this going to help? When are they going to meet with the athletic trainer, or when are they going to do exercises? And why did the athletic trainer pick these exercises for the rehabilitation program? So the patient must always be informed of their treatment. The patient must also be educated about injury prevention and management. So the athletic trainer should educate the patient about injury prevention so that way they don't re-injure themselves when they go back to the sport. And they should also be educated about how to manage their injury at home. Instruction should be provided regarding training and conditioning. That way the athlete does the exercises correctly in order to have the maximum benefit. And the athletic trainer should inform the patient to listen to his or her body to prevent injuries. That way they don't push themselves too hard and either make an injury worse or cause an injury. So I want you to think about it. The two slides I just presented, what are the roles between the athletic trainer and the athlete? What's the role of the athletic trainer, and what's the role of the athlete? You can pause the recording while you think about this and then press play when you're ready to move on. Now we're going to talk about the athletic trainer and parents. So the athletic trainer, if they work at the secondary school setting, will be working with parents closely. Athletic trainers must keep parents informed, and they need to tell the parents about injury management and injury prevention. That way the parents understand exactly what the athletic trainer is doing with their child. The parent's decision regarding healthcare must be a primary consideration because at the secondary school level, the athletes are mostly all under 18, so the parents have a key role in deciding what type of care they want for their child. And also the parents' insurance plans may decide the type of care that the athlete receives because it determines who they have as their physician. And then the athletic trainer, the physician, and coaches must be aware and inform parents of the Health Insurance Portability and Accountability Act, or HIPAA. This law regulates dissemination of health information, and it protects patients' privacy and limits the people who could gain access to medical records. So once a student turns 18, their medical record information is actually protected from their parents under HIPAA. So now I want you to think about the role between the athletic trainer and parents. You can pause the recording while you think about this and then press play to move on when you're ready. Now we'll talk about the athletic trainer and the team physician. The athletic trainer works under direct supervision of the physician. So if there's a team physician, the athletic trainer is their assistant essentially. The athletic trainer can work independently, but they need to get clearance from the physician for all of the care that they provide. The physician assumes a number of roles. One of them is to serve and advise, is to advise and supervise the athletic trainer. The physician and the athletic trainer must be able to work together. It's important for them to have similar philosophical opinions regarding injury management. That way they don't have disagreements or inconsistencies with their treatment. So ideally, the team physician and the athletic trainer should agree on things. And then the physician is responsible for compiling medical histories and conducting physical exams, primarily the pre-participation screening that's done before the season. to rule out any conditions the athlete may have that predisposes them to injury or illness. The physician is responsible for diagnosing injury. The physician is responsible for deciding on disqualifications. So that means if an athlete has a medical condition that would be dangerous for them to play the sport with, the physician can say that they aren't allowed to play the sport. For example, if the athlete has a heart condition, such as an enlarged heart, the physician will say that contact sports are too dangerous for the athlete because it could cause their heart to stop. So the physician is responsible for attending practices and games, and they should have a commitment to sports and the athletes. They can also serve as the academic program medical director, and in this role, they would coordinate and guide the medical aspects of the education program and provide input into the educational content and provide programmatic instruction for the teachers in this program or professors if it's the college level. So here's a picture of a team physician and an athletic trainer working together. The physician is doing the evaluation to come up with a diagnosis for the patient, and then they'll inform the athletic trainer of the diagnosis, and the athletic trainer will develop a treatment and rehabilitation plan for the patient to return to full strength. So think about it. What are the roles between the athletic trainer and the team physician? You can pause this recording and then press play when you're ready to move on. Finally, we're going to talk about the role between the athletic trainer and the coach. So the coach must understand the specific role of all individuals involved with the team, as well as the athletic trainer. And the coach must clearly understand the limits of their ability to function as a healthcare provider in their state. So in the state of California, coaches are only allowed to provide basic first aid and CPR to the athletes. They can't do anything more than that, such as providing a treatment plan to heal an injury. Coaches are directly responsible for injury prevention because they design the conditioning program for the athletes. And so they must design programs that don't cause injury for the athletes. The coach must be aware of the risks associated with their sport and how to minimize the risks in their sport. They should provide appropriate training to the athletes by teaching them how to do drills properly, and they should provide appropriate safety equipment to the athletes, such as football helmets, and the coaches should be certified in first aid and CPR. In California, that's a requirement. The coaches must have thorough knowledge of skills, techniques, and environmental factors associated with the sport they coach, and they should develop good working relationships with the staff, including the athletic trainers. Ideally, the coaches and the athletic trainers will have a cooperative relationship, and they'll have the athlete's best interest in mind. So I want you to think about it now. What are the roles between the athletic trainer and the coach? You can pause this recording while you think about this and then press play when you're ready to move on. And finally, the athletic trainer needs to work with other personnel outside of the roles we just talked about. So the athletic trainer must be aware of available medical and non-medical personnel. So, for example, at Hamilton, the athletic trainer must be aware of who they can work with in the immediate vicinity, so at the school. So at Hamilton, other than the coaches, the athletic trainer has the school nurse, the mental health counselors at the school, and they can also refer the athlete to medical and non-medical personnel who work outside the school. So the patient may require special treatment outside of the sports medicine team at the organization. So if the athlete needs to see like a physical therapist or a dietitian, our athletic trainer would need to refer the athlete to that person. The athletic trainer needs to be aware of community-based services and various insurance plans, and they need to be aware of what's in their local community. For example, in Anza, we only have Borrego Health and Indian Health, and you need to be aware of which athletes can go to those facilities and which athletes need to be sent down to like Temecula for their healthcare needs. Typically, the athletic trainer and the team physician will consult on this matter and refer accordingly. So here are examples of support health services and personnel that athletic trainers could work with. They could work with physicians, dentists, podiatrists, nurses, physician's assistants, physical therapists, occupational therapists, massage therapists, ophthalmologists, dermatologists, gynecologists, exercise physiologists, biomechanists, nutritionists, sports psychologists, coaches, strength and conditioning specialists, social workers, neurologists, EMTs, and osteopaths. So there are a wide variety of professions that the athletic trainer can work closely with, and they need to be aware of what each of these professions can provide for the athlete in terms of sports medicine services and when it's necessary to refer an athlete to one of these professionals. So for today, I want you to answer the review questions on Google Classroom. And tomorrow, we'll be moving on with the lesson, and we will be discussing the education requirements to become an athletic trainer.